So good morning and welcome to Columbus Public Health. I am Health Commissioner Dr. Teresa Long. Thank you all for being here. And I am joined today, as you can see, by many esteemed colleagues and partners in our community's HIV efforts. First, let me just quickly run through them so you know who's behind me and who's with me, really. Columbus City Council members Priscilla Tyson and Shannon Hardin, Peggy Anderson, the Chief Operating Officer of AIDS Resource Center, Ohio, Dr. Mike Pera, Infectious Disease Specialist at OSU Medical Center and Medical Director for AIDS Resource Center, Ohio, Dr. Karla Malvestuto, Infectious Disease Specialist at the FACES program at Nationwide Children's Hospital, and on the faculty at OSU, I just learned. Dr. Brian Beesley and Dr. Chad Braun, family physicians connected to the Carmel Health System. Dr. Jose Bazan, infectious disease specialist at The Ohio State University and medical director of the Columbus Public Health Sexual Health Clinic. Karla Rothan, executive director of Stonewall Columbus. Josh Culbertson, PrEP client, and three of my key members and colleagues right here of our CPH team, Dr. Mashika Roberts, our Assistant Health Commissioner and Medical Director, Nancy Bechtel, our Assistant Health Commissioner and Chief Nursing Officer, and Tiffany Krause, who oversees our clinical operations as our Division Director for Clinical Health. So thank you all for being here. And so why are we here? So we are here today to talk about one of the largest medical breakthroughs in HIV prevention. This game changer is an important new tool in our fight, in our community's fight in the global pandemic, the fight against HIV that has had a devastating impact on our world and our community over the last 3 decades. There have been thousands of lives lost to HIV in the last 30 years. People who have gone before, they have had the full chance to love, to give, and to contribute great things to our world. Despite medical advances, 30 years later, the human toll for HIV and AIDS is still staggering. As of 2013, 2,200 Franklin County residents have lost their lives, a tremendous, tremendous loss. Today, we know there are nearly 4,200 residents living with HIV infection in our community. Clearly, our community has been and is deeply affected. Consider that despite all of our great efforts, we have not been able to move the needle as much as we need to. Since 2003 in Franklin County, actually our HIV diagnoses have increased by 7%. And I hope and I believe that we can change that. That is why we're here, starting today, because these are more than just statistics. These are real people with real lives, with real families and real potential. I experienced the devastation of HIV firsthand when I was a young physician at Ground Zero in San Francisco, working both as a clinician and then at the San Francisco Public Health Department in the early 1980s. At that time, HIV and AIDS was a death sentence, and it struck fear in all of us that were affected, our families, the caretakers, and those of us, of course, in the medical community. A decade later, in the early 90s, the first breakthrough in treatment in the early 90s, again, changed HIV from a death sentence to a complicated condition when supported, but can be ably supported with very effective treatments. We have come a long way since then, and many people around the world, including all of us right here in Columbus, have dreamed of the day when we would have a cure. While your work, let me save that for a moment. Unfortunately, we are not there yet. And while I still haven't lost hope for a cure, I am here to tell you that there is a great reason for hope in preventing new HIV infections. Pre-exposure prophylaxis, or PrEP. Pre-exposure prophylaxis, or PrEP, is a regimen that used once a day using a once-a-day pill, Truvada, which is used to treat HIV-positive persons and keep them healthy and well. The virus can be undetectable. It also now helps prevent, this same medication now helps prevent new infections. While our work continues until a cure is found, and we will, all of us, continue to work until a cure is found, we now have the first medical breakthrough for HIV prevention in more than 30 years. For the first time, this new science-based tool gives us the chance to reach CDC's, the Center for Disease Control and Prevention's aggressive goal of no new infections. That is why we're all here. Some of my colleagues have joined us today to tell you more about PrEP. Please first welcome our first guest, Columbus City Councilmember and Health Chair Priscilla Tyson.
Good morning, and thank you, Dr. Long, and thanks to all of you who are here today, who are here to learn more about the community HIV prevention efforts. As chair of the City Council's Health and Human Services Committee, I applaud you for your commitment to now 30 years strong, to making a significant impact on the worldwide epidemic of our lifetime. While your work and our work is far from over, we welcome this major scientific breakthrough because for the first time, we have a real tool that will prevent new HIV infections in our community. PrEP is about good health for all the residents within our community. And while we celebrate this medical breakthrough, we also know we must continue to keep our eye on the ball. We will support and educate at-risk communities to take advantage of PrEP because they now have another tool to stay healthy and stay well. While there should be an outreach to all segments of our community, we must be diligent about educating minorities, as African Americans are 3 times as more likely to be newly diagnosed with HIV and almost 2 times more likely to be living with HIV and AIDS. As we recognize these disparities, we have to address them proactively, and PrEP is a resource that can be and should be utilized. My colleagues and I on Columbus City Council will continue to support you and the work that we all need to do together for a world without new infections. And again, as you heard what Dr. Long just stated, this is so important to our community, and it is so important especially to people of color in our community. We will get there with all of your help and your commitment and your dedication on behalf of the thousands of residents within this community. I really want to thank the individuals behind me because they work every day on this particular illness. So again, thank you again for all you do, each of you do, to help people have healthier and safe lives. And now one of my colleagues has also joined us today who wants to share some important information about this new announcement. Councilmember Shannon Hardin.
Thank you, Councilmember Tyson. Councilmember Tyson does an awesome job chairing the Public Health Committee, and I'm honored to join her here today. Thank you, Dr. Long, and thank you to everyone that is here. I'm thrilled to join you as we announce the availability of this important HIV prevention tool right here in our community. For the first time in decades, we can actually help prevent the spread of HIV right here in Columbus. PrEP will help protect everyone at risk of HIV, including communities of color and men who have sex with men, both of whom have been disproportionately affected since the beginning of the HIV epidemic. As a community, we now have a big opportunity to prevent new HIV infections and achieve the CDC's lofty goal of no new infections, as Dr. Long mentioned. It's very encouraging that this type of care is covered by private insurance and Medicaid. Pharmaceuticals also help provide assistance to those who need it, which clearly helps eliminate a huge barrier. As city leaders, public health, healthcare providers, and community agencies, we must never lose sight of our goal of no new infections and ultimately a cure someday. Together with Councilmember Tyson, I will continue to work with all of you so everyone has a chance to stay HIV negative, and those who are HIV positive to stay undetectable and healthy. We are committed to this goal, and we will continue to fight with all of you until we get there. And today is a huge step forward. I was really excited about this. I remember when I first learned of the PrEP pill, and I am a member of a gay African American, and two communities that are most affected by this and are still acquiring HIV. We can eliminate new infections. That's huge. I heard about this pill last year, and I said, we need to get the word out on this. We just need to educate folks. It might not be for everybody, but if it is for you, check it out. Ask your doctors about it. I met with my good friend Joe Diaz from Age Resource Center, and he gave me some information. I met with the wonderful folks here at the health department, and they gave me information. I'm looking at this for my own personal health, and I would just encourage folks to just check it out. Just see if this is something that works for you, that might be for you. I'm really excited about these developments. Really excited again to join Councilmember Tyson and everyone behind me in this important work to make our communities safer and healthier. Thank you so much.
Well, thank you, Councilmember Tyson and Councilmember Hardin, so much. We need you, and we have always appreciated your partnership, but we need your support as a community, especially in some of the outreach that we all are going to be about. So let me introduce our next guest, who can actually tell you about PrEP and how it works. Please welcome Dr. Jose Bazan, infectious disease specialist who serves both at OSU, the Ohio State University, and as medical director right here at Columbus Public Health's Sexual Health Clinic. Dr. Bazan?
Thank you, Dr. Long. As an infectious disease specialist, I am standing here today with my colleagues to echo the sentiments of our health commissioner and endorse such an important call to action. For over 30 years, HIV has continued to plague our community here in Central Ohio. But now, healthcare providers have another important and proven tool to help slow down this epidemic. Pre-exposure prophylaxis, or PrEP, involves taking a single daily dose of Truvada, a well-known medication that has been widely used for the treatment of HIV over the past decade. When HIV-negative individuals take this medication before an exposure, it can help decrease the ability of the HIV virus to take a hold of the body and prevent infection from happening in the first place. PrEP has now been shown to be fully capable of preventing the spread of HIV among high-risk individuals in multiple randomized clinical trials with over 11,000 patients. In fact, when taken on a consistent basis, PrEP has the ability to decrease the risk of infection by up to an impressive 92%. Furthermore, clinical trial and real-world data have demonstrated that PrEP is not only effective, but also relatively well tolerated. As healthcare providers, we must recognize that PrEP is a very important piece of the puzzle in helping to prevent the spread of HIV in our community. We must incorporate PrEP into our daily practice and the discussions that we have with our patients that remain at risk for HIV infection, including men who have sex with other men, heterosexual men and women, and those who inject intravenous drugs. However, we must also recognize that other pieces of the puzzle are as equally important. Education regarding safe-sex practices, regular screening for HIV and other sexually transmitted infections, and interventions to help reduce high-risk behaviors need to remain on the forefront of our preventive efforts. Finally, the science supporting the use of PrEP is becoming ever more convincing. As healthcare providers, it is our duty to follow the science, because this is something that our patients not only deserve, but also expect. Thank you. Now I would like to introduce Ms. Karla Rothan, who is the Executive Director of Stonewall Columbus.
Thank you, Dr. Bazan. Thank you, Councilmember Tyson, Councilmember Hardin, of course, Dr. Long. For the last 30 years, Stonewall Columbus has collaborated with other agencies in an effort to assist the thousands of members of the gay community affected by this epidemic, and to help educate our community how to stay well. The health of our LGBTQ community has always been and will continue to be a priority at Stonewall Columbus. Dr. Long reflected on the early days of the epidemic. The impact was real and the losses were immense. I lost many of my friends in the 80s and 90s to this, and it is devastating for friends, for family, and for a city as big as Columbus. We have lost so many. The fact is, PrEP is a game changer. For the first time in 30 years, we have this medical advancement, the first of its kind in prevention of HIV. PrEP gives us one more tool to save lives by helping HIV residents stay undetectable and by preventing new HIV infections in our community. We will never stop until we get a cure. But in the meantime, we encourage everyone to take advantage of this important new tool which will help get us there. At Stonewall Columbus, we support PrEP and encourage all gay men to take charge of their health and protect themselves by getting PrEP, by getting prepped. That's right. Thank you for inviting me. Please welcome Joshua Culbertson.
Good morning. My name is Josh Culbertson. I have to admit I feel rather undereducated with this impressive panel here behind me. I am currently a client with the AIDS Resource Center here in Columbus, and as a gay man who is HIV negative, I currently am on the medication PrEP in an effort to stay healthy and to not expose myself to unnecessary risk of infection by HIV. When I first started learning of this medication, I learned about it, as most people get their news today, through my Facebook news feed. I started seeing posts from the AIDS Resource Center, and I began reading a number of the articles that were out there. And my first reaction to this was that it's too good to be true. I mean, how could there possibly be a medication that could virtually guarantee, not that it is a guarantee, but could virtually guarantee that you would not become infected if exposed to HIV? So I began reading more about the impressive studies and statistics that were associated with this medication. And the more I read about it, the questioning in my head shifted from, can this be real, to why aren't we putting this into drinking water? I mean, why aren't we giving this to everyone? Why isn't this in multivitamins? You know, why are we not doing everything that we can to make sure that we're minimizing the risk of new infections? And I've been on Truvada, the only medication that's been approved for this type of treatment at this time. I've been on it for about 90 days. For me, the side effects have been minimal. For about the first week of taking the medication, I did experience some mild headaches. After that first week, those subsided, and there's been really no impact to my life since then in terms of side effects and whatnot. So I guess, and I've been very open with my family and friends since I began taking this medication, trying to let as many people know that I can about this impressive breakthrough. And I'm really shocked at the number of people that are totally unaware and haven't heard of it and are just amazed to find out that such a medication exists. So I feel like this press conference and any opportunities we have to share with the public and make them more aware of this are so vitally important, because people need to know that this is out there. So while I constantly keep getting asked these days, why did you decide to start taking this medication, I think a better question is, why would I not? Why would I not take this extra step to ensure my health and protect myself? So, thank you.
So thanks, Josh, for telling your story, and what a key question. Why would you not? Why would we as a community not? So again, Josh, I'm encouraged by your story and, again, the opportunity that he and all of our residents have now to stay healthy and HIV-free. I'm also encouraged by our partners in this room. So again, thank you. I want to thank our FACES project at Children's Hospital, the AIDS Resource Center, Ohio State University Medical Center, and frankly, our private community physicians who are stepping forward and saying and providing leadership on this important public health issue. And again, this is just the beginning, but it is about all of us joining together to make this a possibility of no new infections. We do have a long and proud history of working together, and PrEP is just one more tool that we have in our collective fight against HIV in our community. But as I said, our work is far from over. We must continue to work together to educate and to inform at-risk communities and all residents about this new tool that is up to 99% effective at preventing HIV. So what are we talking about? It's in this bottle. This is the bottle of Truvada, and what I am asking all residents at risk to strongly consider PrEP as an important prevention tool. This morning, we have already issued a physician's alert to Central Ohio physicians asking that if they have any patients at risk for HIV, they should consider PrEP. If they are not able to, as a provider, to manage PrEP, that they should refer the patient to a PrEP clinic or a PrEP provider or a practitioner, and to follow the CDC guidelines. We are also developing a public awareness campaign to educate residents, including a publication of a resource guide for PrEP providers. And we will be working, as you can see here, with our community partners and our community providers. And last, but importantly not least, we are also educating our own staff right here at Columbus Public Health that sees many at-risk individuals. And indeed, we will be facilitating the referral to PrEP clinic and PrEP providers. So I urge you, if you are at risk, PrEP yourself. You can be healthy, safe, and HIV-free. At Columbus Public Health, we will continue to support you as we work with all of our providers and partners to reduce new HIV infections so we can truly get to no new infections. And yes, truly protect health and improve lives. Thank you. And my partners and I, and we've got quite a few of them who are very, very knowledgeable, we are all available to answer any questions that you might have. Thank you for coming.
Dr. Long, do you have a sense of what prescription rates are of PrEP locally?
Low.
I would say low.
I would say very low. I think actually Dr. Para sees and AIDS Resource Center Ohio sees the majority, and I've heard recent numbers maybe being a total of about 50, 60 persons. I also know that our FACES project and program at Children sees a smaller number than that, and I actually know that there are several providers, and actually we really appreciate that several of them are here, but I believe the numbers are very, very small.
I have about 60 patients currently. And why do you think that is? Why are doctors not sort of shouting this from the rooftops?
Well, I should probably ask my physician colleagues, and I will ask, and again, do you want to say something?
It's availability.
Sure, up here.
Sure, Dr. Beesley with Mount Carmel Medical Group. I mean, I think the biggest problem we're having is just access to physicians and providers. So access to physicians and providers has been the biggest barrier. Patients just have to wait a long time to get in. Hiring, it's difficult to hire and try to retain providers that are interested in PrEP or interested in taking care of these patients. So I think press conferences like this is going to go a long way to get providers hopefully interested in offering this to their patients and asking sexual histories and asking patients. I see many patients where they'll say, my previous provider never asked me if I'm having sex with men, women, or both. You know, and it should be a beginner question for a med student. I mean, that what these patients are doing. And so it shocks me when the providers aren't even asking. So when the residents come through, we ask them to go ahead and make sure they're trained in how to get a proper sexual history so they can offer this. But access has been the biggest problem.
I'm told that insurance covers the medicine. Can you talk about that?
That's perfect. And actually, that's a great, I think there's, again, lack of knowledge and awareness, honestly, among many providers. We do have, and we're fortunate to have some providers who have actually stepped forward early on. But something that many providers, they need to be aware of it, but two, they need to also, as we want all persons to be aware, that all insurances, all major insurances cover this, Medicaid covers this, and there is a very robust patient assistance program through Gilead, which is the manufacturer of the pill, of Truvada. And so indeed, there is no reason that persons should not be able to receive PrEP. Now, honestly, the guidelines, and again, I'm turning to you, they are fairly straightforward, but it will take providers to go and learn how to provide PrEP. I know that there are multiple different ways. We are looking forward to helping providers learn about this. We actually have given them the instructions and the linkages, but indeed, we need our providers to feel comfortable and confident in being able to do this, or we need them to seek and make those referrals to either private physicians or to some of the clinical programs. AIDS Resource Center, Ohio State, FACES are all prepared to step up and do this work. Karla?
Yeah. I also want to say, there's still a lot of homophobia in Columbus, Ohio, and I'm not just talking about from our allies. It's also internalized homophobia. So to go to your doctor and to out yourself and to let them know that that you are actually even at risk is probably something that doesn't happen very often. And so I think that people are still in the closet. They're still afraid to come out to their doctors, and that's why we have support groups and help in that manner with the center, because people need that support, and they need to know that it's okay okay, and it's healthier in many cases for you to be out and to tell people and to experience that. So internalized homophobia, not just the doctors, internalized homophobia is a big, big key.
Dr. Long, do you feel doctors, local providers are failing in their responsibility to their patients to discuss this?
I wouldn't call it failure. I believe they actually have not been fully informed. And frankly, I'll be honest with you, it felt almost like Josh said, too good to be true. When I first heard about this, I thought, can it really be? And it was really, and I appreciate Dr. Para, Dr. Kolatar, and some others. Dr. Bazan came back from the retroviral conferences, the national retroviral conferences in March, and said, it is way true, and the numbers are amazing. And so again, I think it's partly about people becoming familiar, that it is both very, very, very effective, that it is very available. I do think that what Dr. Beesley and Karla also said as far as this is about patient relationships. How often do you tell the truth to your provider about everything? About everything. And in fact, this is what's really important. This is a matter of life and a significant illness. So we need people, we need our providers to be able to ask those questions, whether they're elementary or difficult for them. We also need our residents to step forward and to be able to share with their providers what indeed might put them at risk. So it is all of that coming together, and now knowing that it is readily available through all of the insurances. There's a robust, as I said, patient in need program. So this is about this community getting prepped.
I think there might be some viewers who would say, what is the chance that this will increase at-risk behavior or promiscuity? Who would like to address that?
So thank you for bringing that up. Actually, that has been one of the big barriers, and I would call misconceptions, because in fact, clinical trial data has shown that that does not happen, and in some instances, folks may engage in even less risky behavior, okay? So I think as providers, we need to recognize that. Like I said, we need to follow the science and get on board with PrEP. So.
So can I just follow up on that? Because actually what Dr. Bazan just said is actually amazing. The data shows that. And what, again, you don't just take a pill and go away. That's part of the management. So indeed, people really need to make a commitment to see their physician every 3 months. During that time, they are, of course, thinking about what their risks are, but they also are then seen at that every 3-month visit for some medical testing, but also they are reviewing what their sexual behavior is, what their risk behaviors are. So it's really not a complete surprise that we actually see no increased risky sexual behavior, but actually a decrease.
Can someone explain how the drug actually works?
Oh, yeah.
In layman's terms. For
Who wants to take that? Mike or? Okay.
The medication has 2 compounds in it, both of which stop the virus from growing. It interferes with how the virus goes from one virus to multiple viruses. And so it stops that. Both drugs independently stop that. And so this is a drug we've used for the treatment of HIV for years. We use it in triple drug combination rather than 2 drugs. But basically it stops the virus. So once the virus gets into a cell, if the drug is in the cell, it won't grow and become more and more viruses. So it stops it basically at the door. It blocks the door from it replicating. One comment I wanted to make about getting information out is when we look at people who go to the physician, most healthy 25-year-olds don't go to the doctor. You ask, who's your doctor? They went, well, I don't have a doctor. And so to communications like this conference are meant to alert these people who really don't have doctors to go to because they just don't generally get sick. Women go routinely, men don't. And so it's hoping to make people aware of this, the community aware of this. And hopefully more people will start asking about it.
Dr. Long, how much of this, the disconnect here has to do with squeamishness and talking about sex and sex lives of other patients? And is that acceptable to you if doctors are uncomfortable discussing sexual health?
Sexual health is a fully a part of our well-being for all of our lives. So indeed, I believe that all physicians should and do likely have some familiarity, but certainly some comfort in speaking about sexual behavior, sexual health. It really is a part of, as you heard, it is a part of medical and clinical practice.
So if that discussion is not being had,
I would encourage all providers to have that discussion. And again, some of us here in public health, as you can imagine, we're pretty used to having those conversations. And everyone wants to know about that. When I go out to parties, everybody wants to know what's going on. So if indeed there are providers that are uncomfortable with talking about sexual health, about sexual practices and sexual behavior, that indeed would be clearly a clinician that we would encourage to both work with their provider partners in feeling and getting more comfortable in that. And of course, if they are uncomfortable in asking questions about sexual behavior and sexual practice of their patient population, I would encourage them. Again, there are very simple questions that can be asked to, again, increase their comfort. And again, if they're not comfortable with the continuing work with someone who is sexually active, who may have a sexual at-risk behaviors, then they also need to encourage that person to seek a provider who is comfortable. Yes. Other questions? Well, thank you all for coming. It was really very helpful, and we appreciate your helping to get the word out. And again, thanks to our colleagues and partners here. Great job. Thanks very much.